Some people who have had COVID can go on to develop long COVID. One of the most common symptoms of long COVID is shortness of breath. This can also be caused by other conditions such as asthma or COPD or a chest infection. So whatever the cause of shortness of breath, it's not very pleasant to experience. And if you get anxious, that can make your breathing more difficult and more laboured. When you breathe normally, you breathe into the bottom of your rib cage using your diaphragm, which is a muscle tucked under your ribs. However, if you experience any problems with your breathing or a cough, then this changes how you breathe and you start to breathe into the top of your chest, which is called shallow breathing. When you do this, you're using muscles that are not normally involved in breathing, so your chest, neck, and shoulders, and this can cause things to get quite tight and stuck, and the fascia and the muscles in this area get stuck. One way you can help yourself if you are experiencing shortness of breath is to do some exercises to help to release these areas. Myofascial stretches and exercises help because they are slow and they progressively allow the fascia and then the muscles to start to release and relax. And as this happens, you can start to feel an improvement in your breathing. Also helpful is doing relaxation exercises to calm your mind and to reduce any anxiety that you may experience. In this exercise, we're going to do a doorway stretch, which helps to stretch out the muscles of the chest. So to do this, just find any convenient doorway and just place your hands on either side of the door frame and then take a step through. So it doesn't matter which leg you lead with, and when you do this regularly, you can change your legs so you keep your balance. And then you just allow your chest to start to relax. So you're not pushing or forcing the stretch, you're allowing your body weight to start to create a stretch that you will feel across the front of your chest. This helps to stretch and relax the fascia and the muscles in the chest, which become very tight when you have shortness of breath or when you've been coughing a lot. You can move your hands to different positions on the door frame to stretch different areas of your chest. And you can experiment just to find out which works best for you. So as long as you're in this stretch for at least a couple of minutes, then the fascia will be starting to release and let go. In this exercise, I'm going to work on the muscles of my chest using a couple of myofascial balls. So the muscles of your chest are not normally breathing muscles, but if you are doing a lot of shallow breathing, they can get tight, they are involved in breathing here, and they also attach into your breastbone, which forms part of your rib cage. So the area that you want to place the balls is just below your collarbone and inside your shoulder joint. So there's a little sort of dip or pocket here where you can place the ball. And I'm going to have them both, one on either side. And so I'm going to lie on my front to do this exercise. So when you lie on the balls, you can do this on the floor, or you can do it on your bed. And depending on what's comfortable for you, you can have your head just resting on the floor like I have, or you might want to put a pillow under your head. And when you're here, you're just waiting again for a sense of the tissues starting to soften and release. So when these muscles are tight, they tend to pull your shoulders forwards. They reduce the amount of space and movement for your breathing. So relaxing these muscles by using the myofascial balls can help your shoulders to drop back and down and to open out your whole chest area. And as long as you're here for at least a couple of minutes, then the fascia and the muscles in this area will be starting to release and let go. In this exercise, I'm going to use 2 inflatable myofascial balls like this to work on the back of my neck. So I'm going to put the balls into this bag, which just means that they'll stay together when I lie on my back. So I'm going to just turn and place the balls under my neck, making sure that the gap between the balls is where my spine is, so it's comfortable. I have a yoga block under my head to support it, and I can either have my knees bent or my legs flat. At home, you can do this on the floor or on your bed, whichever is more comfortable. So when you're here, just allow time for your body to relax and settle into the balls. So allowing time for things to start to soften in the back of your neck. This area is important because the muscles and the fascia in your neck can get tight and restricted when you have breathing issues. Allowing time for these to release and let go can help to relax your breathing. This area also helps to stimulate your vagus nerve. This is a nerve that originates from your brain and it travels through your body, and amongst other things, it innervates your lungs. So if you are stressed and struggling for breath, it will tend to switch off your vagus nerve. But by doing relaxing exercises, in particular this one in the back of the neck, it helps to stimulate the vagus nerve and improve your breathing. As long as you're here for at least a couple of minutes, this will allow the tissues to release and let go. So in this exercise, I'm going to do a towel stretch. To do this, you need a big towel like this, which is a bath sheet, and I'm going to roll this up into a big sausage. And I'm going to lie on this with my head and my bottom on the towel and my spine along it. At home, you can do this on the floor or on your bed, whichever is more comfortable for you. You can have your knees bent or your legs flat. And have your arms by your sides with your palms facing upwards. So the towel stretch is a great whole body relaxation exercise. The towel lifts your spine slightly off the floor, and then gravity starts to pull everything back down towards the floor. And this opens out your body. And in particular, it opens out your rib cage, your shoulders, and it helps to relax your neck and your chest. When you do this exercise, you can do this for longer than other myofascial exercises, and I'd recommend you do this for 10 to 15 minutes. So as your body starts to relax, then this helps to relax your muscles of breathing, your diaphragm, and the little muscles in between your ribs. It also helps to relax all those extra muscles you've been using with shortness of breath. So the muscles in your chest, your shoulders, and your neck. And the pressure that you have on your skull, the base of your skull, and the base of your spine also help to relax your nervous system. And that calms and slows your breathing. So it's a really nice relaxation exercise to do. Probably best done at the end of the day when things are at their tightest. But you can do this at any time if you're feeling anxious or stressed or feeling that your breathing is becoming tight. You can also do relaxation breathing while you're doing the towel stretch. To do this, place your hands on the bottom of your rib cage. And this just means that you can notice your rib cage moving as you breathe. So as you breathe in, your ribs should move out and up. And as you breathe out, they should move down and in. And that means that you're using your diaphragm and the muscles between your ribs to do your breathing. So as you're doing this, focus on your hands and focus on the movement as you breathe in and out. While you're doing this, it's a good idea to count your in-breath and your out-breath. So it doesn't matter how long the count is, just that the in and out breath are even. So if you breathe in for a count of 3, then breathe out for a count of 3. And just focus on doing this. And as this becomes easier, as your breathing becomes easier, then maybe add 1 count to your out breath. So breathing in for 3, then breathe out for 4. And this helps to further relax your nervous system, which all helps to promote calmer, deeper breathing. Doing relaxation breathing for a few minutes, maybe 5 minutes or 10 minutes, can really help to promote better breathing. Sometimes if your breathing's feeling quite tight, it may not feel comfortable to lie on the towel. In which case you can do the breathing exercise seated as well. So to do this, make sure you're comfortable in a chair, and then you can just place your hands on your lower rib cage and just start to focus on the breath and the movement of your ribs. And again, you can count your breath in and your breath out, starting by making them even. And then as things start to release, you can add an extra count to your out breath, which just helps to further relax your nervous system and helps with deeper, calmer breathing. Visit our website to find out more about myofascial self-help exercises, or you can also visit our YouTube channel where you'll find lots more videos like this.